I am Ellen Brown with the On the Road edition at ViVE for the Reverse Mullet Healthcare Podcast. We are on day 3, so I'm a little bit loopy.
Yep.
And I'm here with...
I'm Dave Pavlik.
And we are here with Lee Bowers, which we have known Lee for a really long time. And
Super excited to talk to Lee.
Yeah, and it's super fun to have him on the show. We haven't had him on the show yet. So Lee, tell us why you're here at ViVE.
I'm here at ViVE to meet a whole lot of people. It's a great conference, and I happen to I was asked to participate in a panel discussion yesterday about dual eligibles and DSNP plans.
Which you know nothing about.
I'm learning.
Yeah, I guess by now you might know a little something.
It's been a 15-year build up, and I'm still learning.
Yeah. So tell us about your role and where you came from, because I know you're in a new role.
I'm in a new role. Now the president for Florida Blue Medicare. Prior to that, I was with a company called Centene, and
little company.
Just a small little place.
So I was with WellCare when Centene acquired WellCare, and so I stayed on and was part of the leadership team that ran our Florida operations, our Florida market, and so we had significant market presence, 1.8 million Medicaid lives. We had about 150,000 Medicare, and in the marketplace we were hovering around 500, between 500 to 700, depending on what time frame. So and everything was going great. We actually were going for the RFP in Medicaid, which is through last year and this year, but I decided to step over to Florida Blue Medicare. I really have a lot of respect for what they're doing, and just very exciting.
Yeah, they have a lot of opportunity. I mean, on our consulting side, we have done a lot of work in Florida with a lot of Medicare folks. And Florida Blue is always one of those when we're looking at markets, we're like, man, they just haven't tapped into the opportunity and the potential here yet. So I'm excited for you.
I am excited. They've done amazing things with some of the GuideWell assets with Sanitas and with a couple of the other provider clinics. They've done amazing things on the commercial side, and we're starting to do amazing things on the Medicare side.
Well, we are excited to watch that journey. So
absolutely,
we are here to ask our guests the big question, which is what do you think could affect real change in healthcare, all caps?
Can I ask him?
Yes. Do you want to ask him?
Hey, Lee.
Are you going to say it really loud?
What do you think can affect real change in healthcare?
All caps. Real change in healthcare. I think a universal EMR, some way of setting up a universal EMR where every single record is locatable. Every single member, patient, person who's being served by a physician, any physician at any time, any provider at any time, any home health agency at any time, any hospital at any time
has access.
And can pull it real time, and then provide the billing and coding and other information real time back into this giant record.
So
wouldn't that be amazing?
I feel like we've been talking about that for decades.
You know who I'm going to call out? James Nichols on this because James last night was offering $1 billion. Right? Do you remember this? He was like, if you could spend $1 billion as a health plan CEO, where would you spend your money? And Lee's answer was infrastructure. And I thought, as you're saying this, I'm tagging James, who we plan to have on the podcast in the future anyways, but that to me, there you go, James.
Does
There's
he actually
your answer.
have $1 billion to give?
He is on the equity side of things. And he has some really interesting thoughts around healthcare as infrastructure.
Gotcha.
And this, I think, Lee, your answer, it goes directly to James's point, which is there are infrastructure plays that are needed in the healthcare space. And I think the universal EMR that you're talking about, Lee, is squarely in that idea, right?
Absolutely. It's the one thing that we're all striving, we're all striving to make it a little more consistent, and payers and providers are all trying to get there. Yep. But I'm talking about, real change. And so we can tell James Nichols, I've got a routing number that I can give him for the $1 billion.
I was going to say, he's on his way. We texted him to bring his checkbook.
Yeah, we did. No,
so
we did not.
He'll love the idea, though. That would be real change.
Yeah.
The organization that can get us there will be the organization, I think, that really transforms.
Can kind of save healthcare in a way. Yeah, I agree.
A friend of mine works for the government or a government contractor, one or the other. He's bouncing back and forth, but he's been working on a universal medical record for the military. So all veterans,
I think we need to get him.
They've been working on that for
Since
10
he was,
plus years. He's been on that project for 10
Wow.
plus years, still not done.
Yeah. Yeah.
And that's a small
All
part
right,
of the
well.
population. So it's a big, big task.
I like this answer. I mean,
I like it.
Very good.
I like it a lot. All right.
Excellent.
Well, thank you, Lee.
I have one other.
Oh man,
keep
this
going.
is great. Keep going.
So this
Okay.
is smaller change, but
Okay.
I'm thinking about it from a Medicare perspective. So Medicare, for the Medicare population, have a universal database with all providers. Have like a single provider directory
of all Medicare
of
participating
all
providers.
Medicare participating providers, and put the onus of the accuracy on back. Like make it universal so that all of us plans.
Are not doing
I
the
work for a
same
health plan.
thing.
We all have at least. We might not have the same providers in network, but we'll have the same listing.
No, that's
the same,
brilliant.
The same tax ID number with the 10 MPIs. And when a provider physicians tend to travel around health system to health
Absolutely.
system. So and all of us plans don't keep up with it great. We send our own set of information to
It was
all
said
the
very
providers.
diplomatically.
I was going to
Yeah.
ask you.
We don't all do
Well,
it great.
I was going to.
We also we're depending on the health systems a lot of times to send us back a roster, right? Like and
Exactly.
they could do that once, they could do that twice. They're doing it 10 times for 10 different health plans in 10 different formats.
age-old problem.
See, we don't
I
need.
suppose you
we don't
expect.
always need to focus on the shiny objects.
No, exactly. But
Correct.
I suppose you expect it to be accurate and current too. don't
Yes, accurate and current. So
Yeah, I like it.
That,
I think that would be great. And then would you
talk about great member experience. It's great.
Yeah.
It's
Absolutely.
And then
Yeah.
would you, in that master database, would the providers have the ability to put in, like, would you envision, now I'm really thinking out loud here. I love these spitball sessions, right? How would the health plan participation and credentialing, like, is that something that would happen at that master level?
It would happen at the master level.
Okay.
Credentialing, unless a health plan decided they wanted to, have some kind of more onerous credentialing requirements, but have some certain level of credentialing that CMS requires, and that we all agree on.
Yep.
And then you've got a master database.
Yep.
People, the only thing that the health plan then would be responsible for, then this is a big responsibility, is absolutely making sure the accuracy of the participating providers out of that
Gotcha.
big database.
I gotcha.
It's a big
I love
task.
it.
It's a big task.
Yeah, but that's a great.
Doesn't seem
these
like
are
it should
both-
be, but it's a big task.
I love these two. I mean this, not just because we're friends. I really like the brass tacks nature of these answers.
Yes.
I think
they're
it
fantastic.
would be it was something that we've I'd like to anyway. I think it'd be something great to take to CMS and say, hey, here's a really good idea.
I smell a full episode. I really do, and I'm not
Just on
saying
this
that.
topic.
I do. I think it would be fantastic because we haven't
And
done that.
that's
So
near and dear to my heart. We've been
Yeah.
dealing
Yeah.
with provider data forever. Oh no, he's going to put on the mullet.
Are you really?
He's going to put on. You can't do it over the headphones, I don't think.
Yeah, take the headphones off. You got to do it.
All
I'm
right.
so
For
excited.
everybody listening, Lee Bowers is putting on
the reverse
mullet wig. Oh boy.
I think wait,
He couldn't help himself.
I'm gonna do it too.
He couldn't help himself. Look at that.
Here
Oh
we go.
my God.
I'm doing it too. Lee.
He just couldn't help himself.
I can't even hear through the hair.
Okay. There you go.
All right, Lee.
Okay.
Thanks so much for
Lee
stopping.
Bowers. I got my wig on too.
Thanks so much for stopping by.
Yeah,
Appreciate it.
outstanding.
Appreciate it.
Thank you, Lee. Okay. Bye. Yeah, we gotta get a picture.